Yeah, yeah, good day to you. Big congratulations once again to all the expectant mothers in the house. I want to remind you that it is a privilege to be a pregnant mother, actually, because not every woman can get pregnant or carry their own baby by themselves. Have you thought about that before? So I'm reminding you. I want to say thank you for the privilege to share some knowledge and facts with you on pregnancy. Uh, by way of introduction, this is Dr. Adetuji SA, your obstetricians or reproductive experts at Alifort Hospital. I want to use this moment to reassure you that Alifort Hospital is well equipped with skilled professionals, obstetricians, skilled midwives, and nurses. Also, with standard labor room for monitoring labor and standard surgical theater in case of emergency. Antenatal care is to assure that every wanted pregnancy actually results in the delivery of an healthy baby without impairing the mother's health. So, our focus is the mother and the child. The major goals of antenatal care is to promote and maintain the physical, mental, and the social health of the mother and baby by providing education on nutrition, personal hygiene, and birthing process. It is also to prevent, detect, and manage complications during pregnancy. Those complications, whether it is medical, it may be medical, it may be surgical, it may be obstetric, it may be because of the individual, because there is no two pregnancy that are the same in terms of experiences. Of course, there are general experiences women can have, but sometimes you may exhibit a behavior, a particular challenge that may be different from your friend or someone else you heard about. So, also, the role of antenatal care is also to develop birth preparedness and complication readiness plan. As we are trying to prevent complication, trying to prevent this, we also plan for it because sometimes, of course, what you don't plan for, sometimes you fail when the situation arises. So it also helps to prepare the mother to breastfeed successfully, experience normal post-delivery period, and take good care of the child physically, psychologically, and socially. So, what are the important seminar topics that we're going to be talking about during this antenatal care seminars? One is we're going to tell you important medical terms. There's some medical terms you've been wanting to know, to understand more, you want to get more knowledge about, and facts related to pregnancy. We'll also be talking about the role of vaccines and multivitamins during pregnancy. Also, we're going to be telling you specific signs of labor, specific signs you will see during pregnancy, what they are meant for, how you interpret them, and what do you do, what action do you take when you see those signs during pregnancy or close to your labor. Also, we're going to talk about the techniques of breastfeeding. You can see the demonstration I just gave you. Breastfeeding, baby has come, how do you position? That's just it. So the techniques of breastfeeding, uh, I'll be inviting our midwives, matrons, and some other professionals that will also be talking to you about some of these topics. We're also going to discuss complications related to pregnancy. We're going to discuss family planning after pregnancy, role of sex in pregnancy, okay? Coping with psychological stress during pregnancy, prevention of malaria, prevention and management of infections in pregnancy. Does it have a role? Is it possible that an infection will have effect on your child, will have effect on the pregnancy? We're going to talk about that. Can I zip 40% or 50% during of alcohol during pregnancy? No, those are the questions. So substance use, drugs, and herbs. An herb was prepared from the village by grandma. Can I take it? Can I take it? No. Someone else took it. No problem. Can I? We're going to be discussing so many things about that. The role of nutrition, important diets, important fruits, vegetables that are important, that are good in pregnancy. And so we'll also be inviting a financial expert about family budgeting and child care for pregnancy. And so there's some other topics that I may not have mentioned that we're also going to talk about. We also have interaction with some mothers. We'll bring some mothers to ask their question, and then we disseminate the sessions to you. Thanks so much for today. Thanks so much for this introduction. So we see in the next lecture. Thank you. Bye bye.